Hi everybody, I miss you all. It's kind of sucks doing all this at home and not getting to work with any of you there at the school. But I wanted to talk about core today. Core, we obviously talk about all the time in rehab. If you don't have a strong lower core, you're gonna get injured all over the place. So I want to go over just some really basic core setting because most of us don't do that. And it took me like a year, I would say, of doing Pilates before I really understood how to set my core and what that really meant. So hopefully how I explain it to you will help you kind of get that quicker than me having to figure out like a year like I did. So let's get started. So first of all, as far as core goes, what I'm really talking about today is your lower abdominals, your transverse abdominis muscle. It's below those six-pack abs that we all have, right? So those ones are kind of hard to target, but I'm going to kind of show you how to get those to engage. It's kind of hard, so just keep practicing and you'll get it if you just keep trying and keep trying. So first thing we're going to start with is a pelvic tilt. Technically it's a posterior pelvic tilt. So what you want to do is lay on down, and what you're trying to do, so your pelvis is sitting right here like a ring, okay? And what you're trying to do is take that ring and you're trying to tilt it backwards. So the easiest way I do that is think of this arch in your back that kind of comes off of the floor, trying to push it down into the floor, flatten out that arch. What you're technically doing right there is tilting your pelvis backwards. Okay, hopefully that makes sense. So arch, it kind of helps to arch up first and then flatten out that arch, tilting that pelvis, keeping that tilting, and your tailbone actually comes up, curls up off of the surface a little bit. Now you're not doing a bridge, you're not lifting, you're just tilting using, okay, no, Aiden, stop. Using those abs to do so. And that's Aiden. Okay, all right, back up. Sit. Okay, and what we want to do with that is flatten, hold that flatness, okay? Bring your legs up into this tabletop position. From here, try to keep that flatness against the floor, and if you feel like you want to try to test out the waters, keep your leg at keep your knee at 90 degrees, drop down, and then come back up, and then do the other side. What you're trying to focus on is not letting that low back come up off of the surface, okay? And you might be like, that looks super easy. Just give it a try. If you're not good at core setting, if you haven't practiced it, it's probably going to be harder than you think. If you're getting good at it, though, you can start to drop both feet down and back up. Again, don't let the low back arch up off of the floor. Keep it flat, okay? But that's kind of a good one to start with, just to figure out how to engage those transverse abdominis muscles. If you start doing a lot of this core exercise and you feel like you're just using your hip flexors and your hip flexors are getting sore, that's because your hip flexors are stronger than your abs. And you want your abs to be stronger than your hip flexors, right? But we just tend not to engage our abs as much as we do our hip flexors. So to help with kind of disengaging those hip flexors, grab some sort of a band, okay? Put it around your knees is what I usually do. Get back down here, flatten out that back, push your back down into the floor, lift your legs up, and what can help is if you're doing any sort of ab exercise where you tend to get into your hip flexors too much, push out into the band. That engages your glutes, which actually turns off your hip flexors. If you turn on the antagonist muscle, the glutes, that will turn the agonist muscle off. So kind of just a trick there. But you can do that with any ab exercise. But I would encourage you guys, in any core exercise you do, flatten out your back, tighten your tummy. If you're doing anything where you're laying on the floor, or even if you're doing bridging, don't arch your back as you're bridging. Flatten out that back. Keep your tummy tight, okay? Pretty much the trick is to avoid the arching of your back. And hopefully that will help you guys get a stronger core and pretty much keep yourself from getting injured in many different areas. So good luck. Let me know if you have questions. Bye.